First and foremost, I want to thank Sinclair for inviting me here today to talk to you guys. I want to thank Kara for the awesome introduction. From the top, kind of what Dr. Mark had mentioned to everybody here today, it literally does start from the top, from Andrea to Kara to Donna to Sally, to everyone that's part of that Sinclair. Before them, it was Viora. It starts from them, and it really cascades from there on. So, but wanted to say thank you to them for inviting me here to be a part of you guys here today, to really kind of give you guys my journey, to kind of talk to you guys about kind of how I started, kind of the thought process that I went through, and how we kind of got rolling at my office here. So I want to just let you guys know, open forum. If you guys have questions, let me know. That's why we're here, is to help you guys as up and coming practitioners or who are looking to go into the med spa world. My title, Everything Everywhere Spa Dentistry All at Once, kind of incorporates kind of their platform, really, and everything that goes into what we do at my office, and a lot of the offices that you guys have seen today, the presenters, kind of what goes into their office, that we want to treat everything that we can, all at once if we can, everywhere. So, going to keep going here. So just a little bit about myself. I graduated from the University Dental School in 2016, taught pros for about 5 years. I really love teaching. It was fabulous that Sinclair could get me back into teaching, because I love teaching. I love seeing people excel at the things that we offer. The knowledge skill set that we have, I think that you guys, everyone that's in this room, should be able to excel anytime, anywhere that they want. You just have to get that drive to go and get it. I've been practicing as a general dentist for 17 years. So since 2006, and then in 2008, I bought my office, private practice, small little office in West St. Paul, Minnesota, just right in the heart of St. Paul area. It was family owned. I transitioned literally from a full dental office to a med spa, partial med spa in 2020. I kind of got, my training in Botox, dermal fillers, which really kind of got me going into the cosmetic realm, and then started to really kind of kickstart it from there. And then back literally 2 years ago, converted our office into a full dental med spa. So the biggest thing that I want you guys to take from this presentation is that you guys literally can succeed. It just depends on what you want to go, where you want to go, and how you want to do it. And I'm going to do my best to help you guys understand that, and do my best to help you, guide you in any way we can, because I think you guys all can succeed in this. I wouldn't be here without my family. My two parents are on the side there. I've got my wife, my 4 kids. I look at that picture as we've aged. We're always looking for that fountain of youth, right? Where you look, and as we get older, we get fine lines, wrinkles. I lose hair. My dad loses hair. My mom just wants to get younger and younger, and then my kids get older. Here's me with my 4 kids and my wife, who's here with me today. This was just this past year in Dominican Republic, where I was able to take my entire office for our own retreat to really celebrate kind of our office and team building. So just a little background history on my office. Again, back in 2008, I purchased this office, about 900 patients. Can you guys see the colors on there? You got a green top, kind of an orange building, old school 7-Eleven. They took that building and converted it into a dental office, and coming back into the Dallas area, there's literally a 7-Eleven right down the street, kind of brings me back memories, and I kept that office like this for almost 14 years, and I kept going there every single day. I'm like, man, what is this? What am I doing? So this is a little bit more daylight, so you can kind of see that green top, orange building, two entrance doors for a convenience store, and then you've got my sign there that we switched out in 2008, put my name in there, Family Dentistry. Fast forward to about 8-9 years, we revamped the entire office, painted it nice contemporary colors, kind of light gray, tinted the windows, switched out back in 2022, 2021, decided to change it from Cherokee Dental to Cherokee Dental and Medspa Clinic. to this day, there are patients who still don't even know that we had changed the sign. So, this was kind of a blow up of our sign originally, and here's it after. A little bit more chic, a little bit more contemporary. You know, I will tell you guys, if there is an opportunity that you guys ever want to rebrand your office, and you want to change the name of your clinic or do something spectacular or something that is going to give you a paradigm shift to the next level where you're looking to, this cosmetic world that we are jumping into, I will tell you, is the right opportunity for you to do that. If you're looking to change the name, rebrand, or do something crazy fun, this is going to give you guys that opportunity. Just to fill you in, I just kind of briefly talked to my staff about this, but our building is about a 2,400 square foot building, so old 7-Eleven building. We are actually moving down south 5 minutes to a 6,000 square foot building, upper, lower level, where we're gonna dedicate a full upper dental office, 8 to 10 ops, lower level full med spa, 4 to 6 treatment rooms, and we're gonna be rebranding our name to Beyond Smiles. So that's why I don't really have a lot of my names up here as much, but we're gonna be rebranding it to Beyond Smiles Dental Spa. And I didn't put any of my contact info, but if you do need anything, please come find me. I'll definitely get you guys. I've got a little virtual card that I can send to you guys. Just let me know and I'll send a text to you guys, okay? So I wanted to start out with you guys. So quick question, is everyone here mostly dentists? Can you guys raise your hands if you're a dentist? Okay. Anyone else non-dentist? Nurse practitioners, physician assistant, MDs, assistants, hygienists? Okay, all right. So there's a broad spectrum here, right? So it's nice to, I would tell you guys, it is nice to have everybody from your team see this because it makes a big difference in the success of your practice, right? But as dentists, whether you're a specialist or general dentist, the biggest thing for me is who are we, right? For one, technically we're radiologists, right? Because we take radiographs, we diagnose from those radiographs, we read them, and we treat the things that we find. So technically, we wear a lot of hats. What else are we? We're surgeons, right? We cut tissue, we cut tooth structure every single day. We're surgeons. We do surgery and we restore, right? We're also pediatric dentists. We see kids all the time, unless you are more niche market where you're seeing more geriatrics. But wide spectrum, a lot of dentists out there, we do see pediatrics, right? We see a lot of them. Endo. If you guys are doing endo, technically on a technical scale, you're dealing with nerve tissue, right? You're a neurosurgeon. Anytime you're going into a tooth, you are going in to that tooth and you're amputating that nerve, right? Technically, on a technical scale, right? We are neurosurgeons. Not this, right? If you want to go that route, you sure can. I don't know much about animals, so I usually pass, but there are some periodontists who, do hygiene for animals. The last thing, and I think Dr. John kind of touched base on this too, was we're injectors. Every single day you get a patient in your chair that you're doing restorative work. Most of them you're getting numb. Every day you're injecting. So that brings me to the whole Botox thing. So if any of you guys want to get into cosmetics, right? Botox is probably the first foundation step that you would probably want to jump into because it's the easiest, most simplistic type of treatment that you could offer any patient or client that walks through the door on a very simple scale. Very low, issues that you could have happen to you on an emergency basis type of situation. Very avoidable, very straightforward to treat. The last thing that we are cosmetic dentists, right? We're dentists who always treat cosmetics. Anytime you're fixing a composite on an anterior tooth, restoring a crown or a tooth with a crown, fixing a crack, you're creating cosmetics for that patient, right? So regardless if you do whitening or anything like that, anything that you do that's going to affect their smile line, you're a cosmetic dentist. In the cosmetic world, as dentists, what are we focused on, right? I've got them up there: proportions, symmetry, smile, lip, volume, length, right? Contour, shape, size, right? Everything in dental school. What did we learn? We were taught to make everything as perfect as we could, symmetrical. You get your you know, your interdental lines. You want a perfect smile. You want those lip lines to be perfect. Gummy smile there, you want to correct that if you can. Everything in dentistry is oral focused, right? Oral cavity focused. Now in the cosmetic world, let's jump outside the box for a second. In the cosmetic world, there's really not much of a difference. It is so intertwined, right? What are we looking at for face, full body? Proportions, symmetry, volume, body contour, texture, smoothness, fine lines, right? What's the focus area? Skin, body line, wrinkles, right? That's what we're looking for in this paradigm shift as the cosmetic world has changed so much. This is my thing here. This is kind of what I've always thought about is teeth are our internal support structures for our facial features, just as collagen is a support for our skin. Everything that Viora Sinclair stands for, that you guys will see, that you guys have seen and will be seeing throughout the entire conference here is energy-based treatments that work. Everything that is built on rejuvenation, collagen growth, you know, giving you that youthful look that you're missing, right? Giving you that refreshed look that I always tell patients that come through is, we're not going to give you 30 years, but we're definitely going to give you 10 to 15. You're going to look pretty darn refreshed. So what do we want? We want everything everywhere to look as perfect as possible, right? From our smile to our face, crow's feet, cheeks, nasolabial folds, our body. We want everything and everything to look as good as we can. Whether we can achieve it, we'll get there. We're going to get there. I put this slide in here because, you know, beauty, it truly is in the eye of the beholder, right? But from a standpoint of where you started out, you look in a mirror, to you that is your beauty and how you ever perceive your beauty. But in the cosmetic world, that has changed so much from back in the 70s to now with the blow up of social media, Facebook, Instagram, TikTok. The paradigm shift of what you perceive as beauty has changed so much. Now, when a client comes into your door, right, to them, they are beautiful, and that is great. But they might be coming to your door and knocking on your doorstep and saying, hey, I'm missing something. And it's going to be all of our jobs as dentists and practitioners who are jumping into the med spa world and this cosmetic world to say, hey, let me see if I can help you out. Because if you can, they will be a client with you pretty much indefinitely, because if you can fix that for them or get them to that level, you're going to get that patient in your door. So I've got a couple little comics here that I put, you know, I don't think of my skin as saggy. I think of it as relaxed fit, right? All right? So that's kind of what Viora Sinclair stands for. They're going to take that relaxed fit and they're going to get you back to where, hopefully, where you're at a happy point in your life and where you can really kind of get that skin rejuvenated. I put this one in here because a lot of the times the three things that we can't control is our health, you know, our safety, and the gravity that we are fighting every single day. You know, you wake up the next morning, and this is what you're looking at. You're looking at yourself, you wake up, you're like, man, I look pretty darn good. You turn to your side, and holy cow, everything just slides over, and you got gravity working against you, right? So we're going to help you out with that. That's what we're going to do. So you guys know this? Everyone know this scene? Hopefully it plays okay.
Mr. President, after I destroy Washington, D.C., I will destroy another major city every hour on the hour. That is, unless, of course, you pay me $100 billion.
Dr. Evil, this is 1969. That amount of money doesn't even exist.
So, Dr. Evil, $100 billion. Let's fast forward. Today, 2023, you Google it up. $100 billion exists in just the beauty industry itself. They project by 2025, skincare alone is going to hit up to $177 billion. So I want to ask anybody here, if you guys know, I'll get you a prize here, but does anybody know how many zeros is in $100 billion? Someone shout out a number. How many zeros? 11. She got it right. I'll tell you, I had to look that up and Google it because it's a big number. I'll get you a prize somewhere. Don't forget, $100 billion has 11 zeros. I literally had to Google it up. I asked my kids if they knew. They were throwing numbers like 20 zeros. And I'm like, no, that's not right. But $100 billion. That's what the beauty care and industry right now currently produces worldwide. If you could take 1% of that $100 billion, what do you get? You get $1 billion, right? Let's take, for example, we take 1/10% of $100 billion for that revenue. You get $100 million, right? Let's go further. 1/100% of $100 billion, you're at 10 million, right? Let's keep it going further. 1/1000% gives you $1 million. Let's go final numbers here. 1/10,000th of 1% of $100 billion gets you a cool 100K, right? If you could take just that small snippet of what you're investing in anything that you invest in cosmetics in the world of Medspa or anything that you're doing in cosmetics today, that's a cool $100,000 that you could just put in your pocket. Once everything's paid off, after that, it's all gravy, right? Anybody know this movie? Hangover, right? Hangover.
We have a reservation under Dr. Price.
Okay, let me look that up for you.
Dr. Price? Stu, you're a dentist. Hey, don't try and get fancy.
It's not fancy if it's true.
He's a dentist. Don't get too excited.
I will tell you, let's get excited. Honestly, that kills me every time I watch it. Here's the reasons why, right? We're dentists, right? We're in the dental profession, but we are doctors. You guys got to understand that. If you ask anybody who is a dentist overall, honestly, no one outside of a plastic surgeon literally understands the head and neck better than a dentist, right? We know nerve innervations. We know blood supply. We know how everything works in the mouth. We know how everything works in the perioral area. Why not take it to the next level and go further? If you can, obviously, I know we did touch base on this, that not every state allows you to do what you can, and we'll touch base on that too. But this is kind of where my presentation kind of goes off into the everything, everywhere spa dentistry all at once. You know, in the world of cosmetics, right, there's so many health professionals out there. You've got MDs, DDS, DMDs, RNs, LPNs, physician's assistants, advanced estheticians. You have a slew of healthcare professionals out there and cosmetic folks who do a lot of different things and treatments. Everything, honestly, is intertwined, right? Because you see, in the healthcare profession, we are working together. We are not working against each other. We are working together. But in the cosmetic world, there are only so many things that certain professions and certain titles can do, right? So as a dentist, I will tell you guys, and this is my own quote, is that as dentists, we are, and we will be, I kid you not, I think in the next 5 to 10 years, things will start to change and evolve into a paradigm shift. That dentists are going to be the most versatile healthcare professional in the world. The reason I put that up there is because the first thing, what do we treat? We treat the mouth, we treat teeth, we treat everything in the mouth, right? Is there any other profession that can do that? No, right? What else can we do? We can treat, after that, in the med spa world, in the cosmetic, we could treat lines, we can treat lips, we can treat wrinkles. Now we can also treat with the V-series, we can treat full body contouring without having to do any type of surgery. That's why I say that dentists will be probably the most versatile health professional in the world in the next 5 to 10 years, because I'm seeing a paradigm shift. I'm just jumping into this in the last 3 to 4 years, but I'm seeing the movement towards having a dental and a med spa combination. It is going to be at the pinnacle of that point. And I will tell you guys, all of you guys sitting here, I will be honest with you, you guys are going to be at the forefront of this paradigm shift, because it is going to be massive. And like I said, if you want to grab that 1% of that $100 billion, it's going to be generating way up north of $200 billion, probably sooner than later. So this is the main thing where I kind of go about my journey. I wanted to kind of give you guys a reason why I went into it, kind of my thought process, what made me want to jump into it. This is kind of what got me going, right? So why did I actually get into the cosmetic world as a dentist? The first thing, you see your patient probably more than they see their primary doctor. You see them twice a year for hygiene. You see them for restorative work if they need work. You probably see them maybe 2, 3, 4 times a year. If you get the really good ones, you see them like 10 times a year, right? They max out, right? The other thing is their patients trust you. That's why they come back. They don't just come back because they need somebody. Sometimes they do, but most of the times they come back, they stay with you. They fly in from out of state to see you sometimes if they have to. They trust you. The other thing is opening up a med spa. You guys as a dental office, you guys already have that traffic flow, right? You guys have patients coming and going all the time. You don't need to be sending out flyers. You could, but you don't need to do it to begin with because you can start out slow, you can start out fast, but you already have that traffic flow of patients kind of coming through. The other thing too, as a dentist, you already have cash flow coming through your office. You already have hygiene. You already have restorative work that you're doing. You're doing a lot of dental work that can help cover some of the off balances that you will run into when you invest in some of these energy-based units. If you invest in Botox, derma fillers, right? You're gonna have that cash flow to offset that balance that you owe. Okay, so don't worry. It's like I tell my students when I taught them, don't worry about dental school loans, right? Because by the time you finish, you'll have a job that's going to help you more than help you cover what you have to pay for your loans yearly. Again, how did I start so this is kind of a pathway of how I started here. Back in 2019, literally right before the pandemic hit, I started out with courses at Dentistry. They're a Botox, group that teaches Botox and derma fillers literally strictly to dentists. They are geared toward dentists. They work with dentists. A lot of their trainers are dentists. And so they really kind of helped me set the footing of getting really entrusted into this cosmetic world. I started out with the D1, D2, D4, D5 courses. That's all the courses that they've got, and they go up, again, as Dr. John mentioned, you got different levels of Botox, and as you see every level of Botox, the first D1 class is always packed because everybody's curious about it. And then it kind of weeds out the folks who really want to dive into it. One of the reasons why I got into Botox literally was for TMD and TMJ issues, concerns, migraine headaches, things that are therapeutic. I don't know if you guys know that in the world today, they use Botox for probably over 600 medical procedures. I don't know if you guys know that, but it is crazy. The other thing too is derma fillers. Kind of got into that. I don't do fairly much of those, but I do them when the opportunity arises. And understand though too, as we get older, and one of the reasons why a lot of people are seeking out derma fillers is because by the time you hit between 20 and 30 years of age, you start to lose a percent of collagen every single year. So which is why you start to see the sagginess and a lot of the folds that we get as we get older. That same year in 2019, I actually went from the course of learning it in August to in November of 2019, the IAFA, which is the International Academy of Facial Aesthetics. They were a new group that was kind of starting. They had been kind of in the front of cosmetics and trying to really make a name for themselves, and I think they've definitely done well, and they're starting to spread throughout the North America and even throughout Europe area. They're trying to really draw in from around the world, but it's a great informational, great group to join if you're just starting. They do have a lot of information, a lot of things that they can offer you guys. But that's where I kind of met. That's where I met Sally. Actually, I met Sally there, and I ended up meeting Denise, who was through Fotona, and I ended up going with the Fotona laser to start my office with as a med spa. I ended up purchasing the Fotona laser. It's a dual wavelength laser that does a lot of dentistry because obviously I'm a dentist, right? But with that came tons of other cosmetic procedures. And then what ended up happening was I ended up bringing my wife and my head assistant Amanda down with me to that November conference, and they went to the marketing strategy group, and they saw Sally there, and they came back to me and said, "Hey, there's a fat reduction machine over there. Let's invest in it." And I looked at it and I'm like, we'll take a look. So fast forward, right? Fast forward 2021. I emailed Sally. She sent me an email and she's like, are you interested? And I'm like, I think I am. So I ended up purchasing one of their flagship units, which is the V10. That V10, I got it fully loaded. It came equipped with the VST, which is a skin tightening handpiece. It came with the V-form, which is adipose fat reduction. It came with the VFR, which is a fractional RF ablation handpiece. And I think that was it, the three. And so that was the flagship that I had in my office. I wanted to just kind of make it very simple in what we offered. I didn't want to go full-blown out med spa. I really wanted to focus on a lot of the things that we had control over. One of the reasons why I got the V10 was because it's, as my title says, it's everything everywhere all at once, right? Because that unit alone could do body contouring from the stomach to the neck, to the thighs, to the back, to the flanks, you name it. Anything that had adipose tissue, you could reduce it. The other thing that was awesome about that is it does fractional ablation. It does skin tightening. So I had every single unit that I needed on that simple handpiece there. With it, I also got the Dermafuse, which is, again, the microinfusion there with the serums where we treat a lot of hydration. If I had pictures, I wish I had pictures of my wife's hands when we did it. We did one hand without, one hand with. 3 months later, it is still more hydrated than the other hand. It's impressive. And then we got the InnoPen. I'm still working on that with, we're bringing on an advanced esthetician down the line to really work with that portion for microneedling. So back in 2021, this is kind of the forefront of Viora at the time before they had joined Sinclair, was that their training and their help sessions are probably the most top-notch that I have ever been a part of. You guys all know dental. You guys buy their equipment. They come in, set it up, and you're on the phone the next day and you're trying to figure out how do you do something, right? From day one, anytime I had a question or I had an issue, they were up there working with me, emailing me back, calling me, making sure everything is working fine. When I had clinical issues, it was very quick turnaround. Kara always emailed me back, even though I know her schedule was always busy. So I always feel bad bombarding her, but that's how one-on-one you guys can get with the group. And that's why this whole system, the support system is just top-notch. Then I actually, in 2022, which was just last year, I actually went further. So I was like, well, if we're using the V10, gosh, what do I do if we get more and more patients, more clients coming through? I ended up investing in the V30. Got the Elysian Pro, which is a laser hair removal, and we got the Pristine, which is the microdermabrasion. I literally almost own their entire flagship of stuff. I gotta get the Interjet and maybe sometime, but the V30 got that fully loaded. So we have everything on there from the IPL, the ND-YAG, we even have the VVR, which is the vaginal rejuvenation. I will tell you, it is the most odd thing for me to offer that to a patient, but I will tell you, my wife and we've got an assistant that we converted into a full-time med spa practitioner. The clients that we have treated has been phenomenal. It treats incontinence, it treats leakage, it skin tightens. It is a game changer for women out there. I will tell you, if you are interested in looking that up, talk to Kara. I know she is huge on that. But it has changed the lives of about at least 8 of our clients that we've seen so far. And it is non-surgical, 3 treatment sessions, 20 minutes each, and then it's just follow-up maintenance after that. It is an awesome treatment. But it came with, IPL, which we do for rejuvenation for skin, pigmentation, lesions. We do varicose veins with the ND-YAG. So there's a plethora of things that one can do too, which is what's nice. So as dentists, right, in the dental field, we are looking for that one thing that can do everything for us, right? So you don't have to keep investing in 20 million different units, right? That is their flagship of units. Again, we did the training. How I do training with everybody in my office, I get everyone to do it. The reason I do it is that it's not to really make them or force them to do it. If they ever want to do it on themselves, they know how to do it, right? They know the treatments, they know the treatment modalities. They know what they need to do to power it on and how to work it, and how to take care of it. You invest a lot, you want them to take good care of your equipment. But the reason is because I get my staff, and kind of like Dr. John and his group, is you want everybody all in. You know, you want everyone to be on top and in board with you as you're making these changes to the office, because it's a drastic change, right? So that's the one thing that I have my staff do is I take them as much as I can everywhere I go, you know, to trainings. You know, I do what I can to get them educated, because honestly, when you guys go to a course, and you go back to your office and you're like, hey, I'm going to talk to you guys about what I learned, it's hard to sum all that up in like 20 minutes, right? So you want, you know, you don't have to do that, but it's nice because the staff appreciates it, your team members appreciate it, they get to learn, and they get excited just as much as you do. So a couple things why I chose Sinclair Global as to why I picked their line of units was, you can't find a company that has everything literally at your fingertips, right? They have such a remarkable line of units with multitude of platforms on multiple treatment modalities on single platforms. It's impressive. It is very impressive. The other thing is you always see their photos. You always see their before and afters. You know, they have proven results, and I'll show you some of my treatment cases really pretty quick here. The other thing too that I think is really nice with all of these units is that you can go big or you can go small. You don't have to jump in and spend $500,000 on 2, 3, 4 different units. You can start out with the dermafuse. You can start out with the microdermabrasion units. Keep those two for sure in combination, but you know, I'll tell you how I started out with. I had the dermafuse, we had the microdermabrasion. We have a same big crown unit, right? We're milling a crown, patient sits there for like 30, 40 minutes. I had my assistant go do a nice microdermabrasion for that patient, complimentary. They loved it. What ends up happening after the end of the appointment, they came and signed on a couple of sessions extra after that. You know, there's a lot of different ways you can do it. You can incorporate however you want to. Again, you can go big, you can go small. You do you, and you make sure that you understand where you want to go and what your goal is. The one thing I learned from one of my patients was that if you guys have a dream and a goal, you just have to go look for it and go grab it and keep going. Don't look back, because the moment you look back, you're going to kind of stumble a little bit. The last thing here is I put dentists are doctors who can not only treat the mouth, bring beauty to a smile, but now can treat the whole package with the multiverse of options at their disposal through Sinclair Global. They have everything, honestly, that you guys probably would need, minus the derma fillers and Botox, where you can work with Dr. Myron and learn how to do PRF, and do your own, you know, biofillers, you know. So kind of this, reiterating my path here, this is kind of a little multiverse. If you guys have ever seen the movie Everything Everywhere All at Once, kind of a crazy, weird movie. But it talks about multiverses, different universes, and how they all come together in somehow, way or shape or form, right? So I started out with Botox. We went from there, got the Photono laser, did laser treatments, and then I ended up investing in the V10 and the V30, right? And then after that, we ended up investing in the other things that came along with it that I think is going to be literally our flagship for the next, you know, 5 to 10 years before I start to do even more things with what we're doing at our med spa. So here's a couple treatment cases. This is a patient, 66-year-old female, came in. Her main concern was eyes, right? Wrinkles around the eyelids, crow's feet. 100% self-rejuvenation, skin tightening treatment. That's all we did. We didn't do anything more than that. We did, I believe, 6 to 8 sessions for her, and she's on maintenance for her eyes. Just the texture of the skin, just look at the deep lines around her eyes. They have softened up. The texture of her skin is so smooth. It's unbelievable. So this was a patient, she's very happy. She unfortunately moved down to Florida, but she's planning on flying up for her treatments every 3 to 4 months to get touched up. Here's another patient. I think this is one of Kara's favorite devices to use, which is the VFR. This is a fractional, you know, reduction here. So a couple things I want you guys to key in on. There's still some folds and laxity, right? But look at her skin. Look at all those deep folds and how soft they are, but look at the pigmentation. The pigmentation is almost non-existent. From her dark sunspots, and you look at her cheeks and her forehead, that pigmentation is almost gone. She looks fantastic. We're gonna follow up with her and do a skin tightening treatment for her. So not much adipose tissue, but a lot of just skin laxity. But that's a VFR treatment where it's a fractional ablation, where we're taking off layers of skin and we're really resurfacing it and really causing skin tightening and collagen growth. I put this on there. Right next to this, I put an LT and a BLT ointment. So these are things that you guys are going to want to use for VFR treatments, just because it'll be more comfortable for the client when you do it. Below that is a company called RC Outsourcing. That company, I found located in Ohio. They're their own compounding company. They're a private company. They will sell to whoever. If you're eligible, call them up. They will actually compound that for you guys, and you only pay $90 or $70 for it, and they'll ship it out to you. So you don't have to go to a pharmacy and ask them to compound it for you. This company will do it for you. So if you guys get anything from this presentation outside of the VR and everything, this is a good thing for you guys to take. So we primarily use the LT ointment. We went through both the LT and the BLT to test it out. The LT seemed to work the best. Anybody need that slide? Let me know if you need it. I can get you that later. This is my favorite one, and my last case to show you guys. Look at this patient. 67-year-old female came in. For your left to the right, that's from start to finish. The middle photo is midway through treatment. This woman got at least 15 years back on her life. She looks phenomenal, okay? Look at the folds and look at the skin. Look at the texture. Everything on her face literally changed. Her main concern was her lower face. Then she went from her lower face to her neck and her eyes. This is the full package, 100% non-surgical, 100% self-rejuvenation. She is now on, I believe, Recare, right? So treatments work. Treatments work to the best of their ability. And again, a lot of times it's also case selection, right? Finding out the right selection, the right treatment modality for them to go through. And that's why I always email clinical, because there are cases where you look at it and you're like, man, I could go either this or that way, and you want to find the best treatment that you can possibly give them, because honestly, it's like they had mentioned, this cosmetic market is 100% cash-based, okay? You don't have to deal with follow-ups on insurance, wait for a claim to come by, fight with copays, right? I have patients and clients that come through and I have them pay everything up front to lock them in so we get all of their treatments scheduled, right? It is the most important thing to do for any patient that walks through the door for me, because I don't want to be fumbling around and chasing a patient for a cosmetic procedure. But they're coming to you, remember that. They're coming to you because they want to look like that. I put a couple things just to think about that I thought about what I had to do with my state and how I had to sign up for it when I started the Medspa. Every state is going to be different. If you live in Michigan, anyone and their mom can do Botox. You don't really need a license. You just need a certificate, from what I remember. But you go to Arizona, you go to some of those other states, they are very heavily regulated. If you want to get around that, you can go and find and sign on a medical director. They do that all the time. That's how a lot of those estheticians that have med spas that are doing Botox, that are doing a lot of those other treatments, that's how they're doing it, is because they have a medical director and they're signing them on and they're opening up their own shop. So that's how they can go. Kind of touch base on this with your med spa. If you decide to go through, and I think all of you guys should, because again, you guys are going to be on the forefront 5 years from now. You guys are going to be way ahead of that curve. But take your time. If you want to go fast, if you want to go slow, you find out what's right for you. The other thing is, what services do you want to offer? Do you guys want to offer Botox and just derma fillers? Do you want to do full body contouring? Find out what you want to go and then create your own menu, create your own slides of what you want to do, and then offer it. How I offered it to my clients, I didn't even offer it. I just kind of slowly, tweeted in their ear that we might be doing this. After that, once I purchased the units, we had pamphlets. I literally threw pamphlets out in the waiting room, and patients came like, hey, what is this? Are you guys doing this here? And that's where it goes. The second thing is, my entire office is versed and well-trained in this, in all of these procedures. They are my personal advertisers. Without them, I wouldn't be here today. And I live and die by my team. So the other thing is, find out find your niche in this market, right? Find out what works for you. Again, kind of go into rebranding. If you guys want to make that change, this is a great time to do it. And then again, just reiterating Sinclair Global, they have everything you need for you to succeed. I will tell you, you go to dental school, it takes a lot for you to get kicked out of dental school, right? Because they don't want to see you fail. Sinclair is the same thing. They do not want to see you fail in anything that you purchase and anything that you invest. Botox is a different situation because they don't do that. So if you fail on Botox, I can't help you out with that. But I will tell you, they will be here to really give you guys the resources that you need to succeed. Another little quote here that I came up with, the overall outcome from a dental and a cosmetic perspective, we're going to help our clients get healthier. They're going to be more health conscious, right? And lastly, they're going to look and feel healthier. That's the goal. The goal is to find that fountain of youth at the minimalist and most non-invasive way you can, right? Because a lot of the paradigm shift now, there's always going to be a role for a plastic surgeon. But I'm seeing the paradigm shift, and a lot of folks is non-surgical and self-rejuvenating. I mean, that's where I see it going. Just a couple pearls to take with you guys on the treatment side. The biggest thing is set realistic expectations. Because when you have a client that comes through your office and is expecting a full facelift with the treatments you're offering, it's not going to happen, right? Unless you go to a full plastic surgeon. But set realistic expectations, and like they had mentioned, under promise, over treat, or whatever. That is a good line, because you don't want to overpromise and then you get to the point where like, man, it's not what I expected, right? So just make sure you set good expectations. You create your own portfolio. How I did it was I offered free treatments. I offered a lot of treatments at super discounted rates. In exchange, they gave me their photos. They let me take good clinical before and after photos. That's your selling market, because those are your clients, those are your patients that you're going to use to really rope someone in, because you can say, hey, it worked for them. These are our clients. It works, right? Again, touching base on, complimentary services, kind of like I'd mentioned, if you're doing same-day crowns, give them a complimentary facial. It's very minimal out of your pocket. And then, again, photos. That's the one thing I will say was I wish in the beginning of when I started this, I was expecting clients to come through my door doing head and neck. We're dentists, right? Head and neck is what I expected. I had the first 10 patients come in for stomach. Literally 100%. First clients were all stomach, abdomen. I wish I was going to put some photos, but they just didn't look as good. But I will tell you, a lot of the patients and clients that we saw, they lost about 3 to 4 inches off their waist. It was remarkable. As long as they kept their weight, they ate the way they were supposed to, and they drank and hydrated with a lot of water. It was phenomenal about how much they lost around their waist. It was pretty impressive. And the last thing I will tell you guys, again, include your staff, okay? Include your team member, because it is such an integral part of your success. They are exponentially related to how well you're going to do in your practice, because if they are not on board, you are going to have a hard time selling. I had one patient, and this goes on the whole, investing in dental care, right? I had a client who came in, and she was like, crying to me and saying, I have not slept. I hope she doesn't watch this video, but she came crying to me. She broke her night guard and just having massive headaches, crying. I was like, okay, well, we can make you a brand new one, roughly about $600. I'll discount it for you. She's like, oh, no, I'll just work with what I got. Weeks worth of just misery. A month later, I roll out the Medspa stuff, and she drops $4,000 on cosmetic work. It's priorities. It's insane. But it was my staff who really helped talk to her, that said, hey, you know what? We can get you going on this Medspa stuff, even though your head hurts. Things work, right? So, but again, I wouldn't be here without my staff. This is my team member when we first started. I took over my office. Started with just the 3 or 4 of us. Then we grew up. Oh, not grew up, but grew together, and I tripled my office staff within the last 6 months, because that's how fast we've been growing. And here's our final group photo. We were at the Wisconsin Dells at our last retreat here, just hanging out, having a good time, team building, and I'm telling you guys can do the same thing, because if I can do it, you guys can do it too. Thank you guys so much.